I'm just gonna coin these little talks car chronicles because it seems like that's the only time, that's the best time that I have to actually make these videos for YouTube. So for those that don't know me, my name is Patrice. I am a family nurse practitioner, and I specialize in internal medicine full-time and urgent care PRN. Good morning, YouTube. So today I kind of wanted to talk about how to get the most out of your preceptorship as a nurse or a nurse practitioner. So I am a novice. I'm still a novice nurse practitioner, but I do like to precept students because one, a lot of nurse practitioner students have to find their own preceptors, and I understand how difficult that may be. And two, having a student actually keeps me on my toes and makes sure that I know my shit. So I really enjoy having the students because we kind of learn and brainstorm together. But I find that when I have my students, the few students that I have had so far, I feel like they don't necessarily maximize the time that they have in clinic. And I think that's because maybe they don't know that they're not maximizing their time or maximizing their experience. And I can speak from experience myself because I remember my first clinical rotation, I didn't know what to do. I knew how to be a nurse, but I didn't know how to be a provider. So I completely understand the apprehension that you may have or students may have when they get into the clinical setting and they're having to make decisions about a plan of care. So my first piece of advice would be to ask questions. I don't care how dumb you think the question may be. It's not really a dumb question. So ask questions about everything. Ask questions about why your preceptor chose maybe the medications that they're using. Ask why they chose to do certain lab tests or radiology, or why they chose to send a referral instead of managing the patient on their own. Just ask questions. Ask about the charting system because a lot of them are similar. Ask about the schedule. Ask about everything, how they like working with their coworkers, and who do they go to, who does your preceptor go to when they need to collaborate and need help with a difficult case or something that they've never seen before, something that's foreign to them. So ask questions. It doesn't bother me, and it keeps me on my toes because I feel like I have to justify what I'm doing when the more questions you ask. And then you may catch or give your preceptor a good insight on maybe something that's new to practice or something that's changed in practice. So don't be afraid to ask questions. The next tip that I have is to be involved. So if your preceptor goes in a room, go in a room with them. See how they deal with their patients. See how their relationship, how do they interact? What is their system? How do they set up every morning? Go everywhere with your preceptor. I know when I was in school, I wanted to know not only how to manage these conditions and which medications to choose. But I wanted to know, how does your day run? Is it smooth? Is it chaotic? Like, what do you do when you get there in the morning? Like, what kind of system do you have in place? Because once you get out and you start to practice, you can take little pieces of what you have learned and what you have watched in your clinical practice and use that. Or you can take little pieces and not use that because that doesn't work for you. So go everywhere with your preceptor. Go when they're consulting with a physician, go in there with them. See what they're talking about. See what that relationship is with the colleagues in the clinic. See how they interact with their MA. See how they interact with the referral coordinators, the behavioral health. Watch everything, because I'm telling you, you don't think it's going to be important or useful now, but when you get in your practice and you start to do the same things, because every practice is similar. When you're dealing with primary care or internal medicine, you'll notice that maybe you can use something that your preceptor used, or maybe you can approach people the way your preceptor did, or maybe you cannot approach them the way your preceptor did. So you can learn negative and positive. You can take away what you want. The third thing that I would say that nurse practitioner students or nursing students need to do, or what they can do in practice, in clinic, is to be on time. So if your preceptor starts at 7:45, then you should be there ready to see that first patient at 7:45. It just makes your preceptor want to be involved and know that you actually care about what's going on in clinic, and not that you're just showing up. So my goal as a preceptor is to, one, give you the little bit of knowledge that I do have, share that knowledge with you that you can take away whatever you want, whatever you choose. But two is to help produce great nurse practitioners. I really take preceptorship seriously, because what you watch and how you interact is, you're going to take away something from that, and you're going to take that into your own practice. So if it's something that's negative, then you could potentially take that into your practice. Another thing I think is helpful when you are working with your preceptor is to know what your weaknesses are, so those can be addressed during clinic. So I had one student who, she knew that she was weak in women's health, and when I first met her, she was like, this is what I'm weak in, this is what I would like to learn more about, and that's what we did. So not only did we do the typical day-to-day things, when I had women's health patients, I would have her be completely involved and develop the plan of care, because I knew that's what her weakness was. So identify what your weakness is prior to clinical. If you're not good with women's health, if you're not good with diabetes, if you're not good with managing blood pressure, then identify that, because you can make that weakness become a strength working with your preceptor. Another piece of advice that I have for those that are doing their preceptorship with a nurse or nurse practitioner is to come prepared. I know that sounds simple and it sounds silly, but if you're in clinic, you need to treat that like you're at work. So you need your stethoscope. You need like normal clinic stuff. You can't just come and walk around with your notebook and expect to get the most out of your clinical experience. I'm I'm the type of preceptor where I'm going to have you assess, but when I assess patients, if I hear or see anything abnormal, I want you to hear and see it as well, just so you'll be able to recognize it when you begin to practice. So come prepared. Make sure you have your stethoscope. Make sure you have anything that you need that's specific to that clinical rotation. Another tip for students is to be proactive. Ask if you can go in that patient's room before before your preceptor does, to kind of get your own history. Ask if you can formulate the plan of care and see if you guys can go over it together so you can gain a better understanding of what's going on. Ask if you can help with that procedure that they're doing. Just be proactive. It's just you get what you give out of preceptor in your preceptorship. If you want to sit back and just kind of watch and not be hands-on, then that's what you do. But just know that you're going to be in the position where you have to do the managing of the plan of care. You have to take care of this patient. You have to be able to know what you're doing and why you're doing it. So the more hands-on you are, the better it will be for you. The last piece of advice I have for those that are precepting is to look at your preceptor's schedule prior to your clinical rotation, so you can be prepared to ask questions about the type of patients that they're seeing that day. So if you have computer access, take a look at their schedule. See how many patients they're seeing. See what types of patients they're seeing, and potentially formulate questions based on their future schedule. Now, I understand that schedules change, but typically the types of patients that you see in primary care don't. So you're always going to see diabetic patients. You're always going to have patients that you're managing their blood pressure. You're always going to have that patient that you're managing their thyroid. There's always chronic conditions that don't really change in practice. You just manage them based on their individual needs. So take a look at their schedule, see what's going on, ask potential, or write down potential questions that you may have. And if you don't have computer access, then have the medical assistant print out the schedule. They can print out the schedule. You can see exactly what type of patient it is. You can take a look at their medications. It just gives you more opportunity to learn in the clinical setting, because you're actually preparing and you know what you're going to ask and what you don't know if you actually prepare for your clinical rotation. So once again, my advice is to look at the schedule and formulate potential questions that you may have about any patient's plan of care. Thank you for taking the time to watch my video about tips for nurse practitioners when they're doing their preceptorship. Please leave any questions below, like, comment, and subscribe.